I've had the opportunity to work with biotheranostics for a number of years, first in the research setting and now in clinical practice. So the bioT3 platform was not available when I first started doing research with them as part of a consortium looking at carcinomas of unknown primary site, but currently use it in my everyday practice when confronted with one of several situations. So the bioT3 platform is made up of two components, the first component of which is the cancer type ID. The cancer type ID is necessary when we're looking to identify where a primary site of the patient's cancer is compared with what we think it might be. If unidentified using regular tools, the cancer type ID can help us separate those. An example might be a patient who presents with abdominal carcinomatosis, and we don't know if it's a GI or a GU primary. Again, this can help us focus in on and identify where the primary site is. So the cancer type ID will help us both in the carcinomas of unknown primary site and in those ambiguous states where it's not obvious where the primary site was and several possibilities exist. We find the cancer treatment NGS Plus to be helpful with next-gen sequencing and the FISH and the immunohistochemical studies that add an entire comprehensive platform. So now with this information, it lends us the opportunity to select therapies, actionable therapies, based on these potentially actionable targets. We're a guideline-driven society right now, and much of what we do is based on guidelines provided to us by the National Comprehensive Cancer Network, or NCCN, and also the American Society of Clinical Oncology, or ASCO, where the bioT3 platform condenses all of this, uses the National Comprehensive Cancer Network guidelines and phase 2 and phase 3 trials in late stage to give us information that we can actually act on. Some of the very complicated reports that come out when you do extensive next-gen sequencing leaves a lot of physicians today really in a position where they don't understand where to go next. And there would certainly be times where we would combine these two together. A good example of that would be an unknown primary site, or let's say an ambiguous primary site that we thought might be lung. So the cancer type ID would help us say, well, this is a non-small cell lung cancer. It's non-squamous, so now we want to make sure or understand better whether there's an actionable target or not, specifically ALK, ROS1, and EGFR. So combining them together in this instance would be a perfect help for us to set up a treatment program that we could carry through for many lines of cycles.